We're pretty sure if you're listening to us today, you have a blood pressure. And actually, there's a 50-50 chance that yours is too high. And we know that most people don't want to be on medications. I myself am included in that. So today on Living Heart Smart, Matt and I are going to talk to you about ways that are proven to lower your blood pressure without medication.
Yes, it's about time we did this because I think every single day we get asked, how can I lower my blood pressure on my own? I want to either take no medicine or less medicine. What can I do? And fortunately, there's a lot you can do. So that's what we're dedicated to today, is really just talking about these few different things that are proven. There's good data behind it. And those are the kind of things we like to recommend to our patients as to what you can start doing to get your blood pressure down on your own. Now, this doesn't necessarily replace medications. Oftentimes, this is in addition to or to help lower the doses. And for some people, though, I think this can help you avoid medications altogether. So these changes are real and they work.
First things first, you have to know what your blood pressure is. So it's time to start monitoring it and checking it at home, track and trend.
Yeah. And I think if you want to make a plan to start lowering your blood pressure on your own, which is perfect, we love that. We encourage you to do that no matter what your blood pressure is. You need to have a plan. Like Carolyn said, you got to start a list. And then you got to start thinking about 3 months out, 6 months out where you'll be, because this is going to take some work. Lifestyle changes are not easy. Breaking habits is not easy. And so we're going to be asking you maybe to break in some of those habits to make this happen. I think we should break this down into 4 major categories of things that you can do starting today that are going to help lower your blood pressure. Number 1, some dietary changes. Number 2 are some behavioral changes. Number 3 are exercise changes. And finally, and maybe most importantly, is some weight loss. So hopefully if you take care of 1 through 3, the 4th one will come along for free, but it's going to take work.
So the first thing that Matt listed was dietary changes. And there are really 3 big dietary changes that you can do to help lower your blood pressure. The first one is lower your sodium. The next is increase your potassium. And the third one is reduce calorie intake.
Yeah, those are all important, and they kind of all act individually. They all benefit you or blood pressure in some way. I'll start with sodium. The average American diet is getting about 3 to 4 grams of sodium per day. That's 3,500 or so milligrams a day. So what we should be shooting for is at least less than 2,000, maybe even less than 1,500 milligrams per day, depending on what your blood pressure is doing. But the way sodium works on you is that it works down in the kidneys. And the first thing it does is it causes some vasoconstriction, which is a tightening of the vessels, which can raise blood pressure. But even maybe more importantly is it causes you to retain sodium, which then causes you to retain some fluids. And that fluid is what makes your ankles puffy and what raises your blood pressure as well. So a low sodium diet really works. And you can expect 5 to 7 milligrams of blood pressure lowering just from decreasing the sodium in your diet.
Almost as much as 1 blood pressure medication, sometimes lowering the blood pressure. And if you were thinking about lowering sodium, we actually, on the opposite side, we want to think about increasing potassium in our diet. And the average, I've never really thought about potassium foods in my diet.
It's a new thing. The more I read about blood pressure, the more I see how important potassium is. So I'm starting to focus on that as much as I always have with sodium.
Right. And potassium, that will lead to vasodilation, which is the opposite of vasoconstriction.
Yeah, it kind of counter-affects the effects of sodium, right?
Right. There are some people out there that are going to need to be very careful about how much potassium they take in, but that's something that you can talk with your doctor about. And it's really easy to Google high potassium foods to see where you can really bump up your intake on a day-by-day basis.
I think the most important thing, the most important thing for both of these is just you have to start looking at labels. Reading how many portions there are, what the sodium content is, what the potassium content is. And cooking with fresh foods kind of takes a lot of that off the table, so you don't have to worry about it. Anything in a can, anything in a box, anything that's got shelf life, you should be concerned about sodium levels for sure. The next thing on our list is cutting calories. You'd say, well, how can cutting calories help? Well, I think what happens is people think they're eating a healthy diet, but they're still eating too much. So if you do need to lose weight, cutting calories helps. If you're eating just too much of a good thing, that can still raise blood pressure because there's salt hidden in everything. So just be aware about portions, portion control, and cutting calories in general, especially if you need to lose a weight.
Actually, Matt, when you tie all of these things together, when you tie decreasing sodium, increasing potassium, reducing calorie intake, there is a diet that the American Heart Association has recommended. It's called the DASH diet, DASH. And that's one of those diets that you can Google. You can find some recipes to follow and start looking in on how to
Yeah.
change your diet around.
Yeah, no, that is the diet, right? Dietary approaches to stop hypertension. It's in the name. The DASH diet is the perfect diet for someone with high blood pressure.
Number 2, behavioral changes. It was supposed to be number 3, but Matt made it number 2. So we're going to just jump on into the
I was too
behavioral
excited
changes.
to talk about behavioral changes.
He's so excited for it. And when you get down to what behavioral changes we're really talking about, it's alcohol, tobacco, caffeine, stress, and sleep. Those are the major behaviors that we're talking about. We've talked about alcohol before, and we know that alcohol raises our blood pressure on a sustained level. So minimizing that and reducing that to real moderate levels is really important.
We did a whole episode about alcohol use and its effect on the heart and cancer and other things. So please take a listen if you haven't seen that yet.
So smoking, we know. Everybody knows. We say it every episode. If you smoke, you have to quit.
No smoking, no smoking, no smoking.
No smoking, no smoking. And when it comes to caffeine, that's an area we know that caffeine can increase your blood pressure. We don't know how much is too much, but if you know that you're one of those people that's drinking 4, 5, 6 cups of coffees, Diet Cokes, et cetera, every day, and you're looking for another way to start reducing your blood pressure, maybe cutting back on the caffeine intake is probably a good idea.
Yeah, I've seen so many people react differently to caffeine and all these factors. Cutting back is an easy choice to at least start seeing how it affects your blood pressure for sure. Yeah, the other part of this whole behavioral changes kind of thing is stress, right? We all feel stress. Every one of the patients I talk to says I've got stress, whether they're retired or young or working or kids or who knows what.
There's always stress.
It's always going to be stress, right? So how to quantify that, how much of that is affecting your blood pressure, it's tough to say. It's an additive effect. I think if you've got too much caffeine, a little bit of alcohol, some stress, lack of sleep, these things all add up. So the data on stress management techniques is pretty weak when it comes to actually lowering your blood pressure, whether it be yoga or acupuncture or meditation. But I'd say whatever works for you is what's going to work. So stress levels, keep them low, getting good sleep, avoiding caffeine, cutting back on the alcohol, all those things are additive. And if you're trying to avoid more medications, do your best to cut back as all those places as you can. Okay, so those are behavioral changes. We talked about diet. Let's move into some exercise. Exercise is a great way for stress relief, by the way. Get out there, get moving, free your mind, get the body going. So, but exercise alone can lower blood pressure. There's very good data about aerobic exercise and blood pressure lowering. It's not the same day, it's not immediate, but the 4 to 6 weeks into an exercise regimen, if you're doing it regularly, you can expect to see a 4 or 5 millimeter of blood pressure falling. And those effects only last as long as you're doing the exercise. So if you want those to continue, you need to be consistent, right? The guidelines are pretty clear. You want to aim for 150 minutes of aerobic exercise, of moderate intensity exercise. And if you can't think of it that way, then Carolyn?
So that's where we get our 30 minutes 5 times a week. But it also counts if you do 10, 15-minute blocks over the course of 7 days.
Yeah.
It really doesn't matter how you break that time up. You really need to clock in the time.
Just clock it in.
Remember, my moderately vigorous is probably different than Matt's moderately vigorous, and it's probably different than your moderately vigorous. And all 3 of those are right. As long as we're pushing ourselves to a point where we feel like we're working out, it really doesn't matter what you're doing, what form of exercise you're taking. You want to just feel like you're pushing yourself.
Get that heart up. Yep. There's also some decent data. It's not as strong as aerobic exercise, but for
strength training.
Strength training, yes. Do you want to talk about that a little bit?
Yeah, I think the data when it comes to strength training in and of itself for lowering blood pressure, I don't think that data is really strong. It's really the aerobic exercise that has the data behind it that's what's really proven to lower your blood pressure. But when you think about what strength training does, increasing your muscle mass, the other things that does for your body is it improves your insulin resistance, and that will be a whole new wormhole that we go down.
And so, get the body moving. I think that's really going to help you. Okay, and that finally brings us full circle to number 4 on our list of things you can do to lower your blood pressure on your own, and that is weight loss. Weight loss really works for lowering blood pressure.
It does. And hopefully, if you're working on numbers 1 through 3, hopefully the next logical step will be some weight loss.
Well, if you do the DASH diet, if you cut out alcohol, if you start exercising most days of the week, weight loss should follow. And the benefits of weight loss may be the best thing you could do for your blood pressure. The data is overwhelming. If your weight loss really is one of the best things you can do for yourself to help bring down that blood pressure. The data says for every 2.2 pounds that you lose, you can drop your systolic blood pressure by a point or so. What that means for everybody is a little bit different, but I've seen significant amounts of blood pressure drop with moderate weight loss. So the numbers really work. And if you can peel off a medicine or two, or even stop from adding more medicines, it's a huge benefit. And like Carolyn mentioned, if you're doing steps 1, number 2, and number 3 right, number 4 should fall into place pretty easily.
Maybe not as fast as people would like. When we're talking about weight loss and we say things like moderate amount of weight, we're really talking about just about 10% weight loss. And I have seen it so many times where patients will come in and they haven't lost lots, but maybe 10 pounds, maybe 20 pounds. And it's such a great day when they're telling me, look how much I've lost. And we're pulling back on blood pressure medications because they really just don't need them anymore. Their blood pressure has been really good.
Mentally and physically, it's a win-win. Yeah, exactly.
It's a win.
I think we covered the 4 big things we wanted to talk about today. These are things everybody can start doing, whether your blood pressure is high or not. These are all good for you. And hopefully, if you make these changes, stay committed, keep going at it over time. These really work. So good luck to you, and thanks for listening.
Thanks a lot.